Knock, knock, knock. Enter the room, provide privacy, wash my hands. Hi, my name is Ashley. I'm going to be your nurse today. We're going to be doing a head-to-toe assessment. Is that okay with you? Can you tell me your name and date of birth?
Lighting Grove, July 4th, 1996.
Okay, can I check your wristband just to confirm that? Great. Do you know where you are and what time it is?
Around noon, my house.
Okay. Do you wear any assistive devices?
Yes, wear glasses.
Okay. So overall, your physical appearance, you seem healthy. I don't see any physical deformities. There were no involuntary twitches when we were speaking. Your nutritional status, you seem well nourished. There's no signs of malnutrition. Your skin is appropriate for your ethnicity. You're sitting erect. Your posture is erect. You were able to respond to my questions, so your speaking and hearing is intact. Your A&O is ×3 because you're able to tell me person, place, and time. You seem calm and relaxed. Your assistive devices were your glasses. And yeah, so now we're going to move on to your vital signs. So has anyone ever told you that you have high blood pressure?
No.
Okay, so normally we would do temperature, but because we don't have the equipment, we're not going to be doing that, but the normal range for that would be 97.8 to 98.6. So we're going to go ahead and move on to taking your pulse. So I'm going to come right here. I'm going to go right by your radius and into this groove, and I'm going to feel it for 30 seconds. I'm going to multiply it ×2. Okay, so your pulse was 68 beats per minute, which is great. The normal range for pulse is 60 to 100. And then I also took your respirations for 30 seconds that I was going to tell you. And that was 16, and the normal range for respirations is 12 to 20. So everything looks great. We're going to go ahead and take your blood pressure. So if you could just take one arm out, so I could do that. And your radial pulse, it was a 2+. Can I feel too much just by 1? 2+ bilaterally for your radial pulse. So I'm going to go ahead and feel your brachial. Your brachial artery. I'm going to go ahead and put this around it. Is that as far as you know? But I'm going to go ahead and I'm going to feel your radial pulse while I'm inflating the cuff. I'm going to stop feeling it at the number. I'm going to add 20. I stopped feeling it at 160, so we're going to add 20. I'm going to inflate it to 180 when I am taking your blood pressure. Let's start taking the blood pressure. (128/64), which is within the normal range. Systolic is 120 to 90 is what they want for systolic, and then diastolic 60 to 80. So everything looks great. From a scale of 1 to 10, are you in any pain?
No.
No?
1.
1? Okay. And then also O2 saturation is another vital sign that we would take, but again, because of lack of devices, we're not going to do that. So the normal range should be 92 to 99%. So great. Do you get headaches frequently? No? Okay, so could you take your hat off for me? All right, so I'm going to be looking for any, I'm going to go ahead and palpate and inspect at the same time. I'm going to be looking for any masses, lesions, bumps, anything like that. I feel a little bump towards the back of your head, kind of at the proximal portion of your neck. Other than that, I don't feel any bumps or masses on the lateral sides of your head. I'm going to go ahead and kind of sit up a little bit. I'm going to be looking for any infestations. I don't see any infestations. Look on the side. There's no infestations. The skin color is pink on your scalp. Your hair is thin and fine, and long and straight. Did you feel any tenderness?
No.
Okay, so non-tender, great. Have you had any seizures before?
No.
Never had any seizures? Okay, so looking at all of your facial features, your eyebrows, eyes, nose, mouth, your face is symmetrical. There's no facial drooping. Your skin color is appropriate for your ethnicity and consistent with the rest of your body. So everything looks great. I'm going to go ahead and feel your temporal artery. Is that okay?
Mm-hmm.
Okay, that is a +1 bilaterally for your temporal artery, excuse me. We're going to go ahead and move on to your eyes. Do you wear any glasses or have any sensitivity to light?
Yes. A little bit.
Okay, great. I'm going to grab my pen light. So looking at your face and your eye area, your eyebrows don't and eyelashes don't show any unexplained hair loss. Your eyelashes go curve outward and are straight, evenly distributed. Your eyelids are able to open and close with ease. Your sclera is white and free of any foreign bodies. Can I take a look at your conjunctiva? Your conjunctiva is pink and with small blood vessels present. And go ahead and look straight. I'm going to look at your cornea. Okay, your cornea is smooth and round without any foreign bodies present or any lesions. So everything looks awesome. Go ahead and look at me. Your iris is green. Your pupils are about a size 5 right now. Great. Okay. So now we're going to go ahead and do some tests. We're going to do the corneal light reflex. So I'm just going to shine this right here. Okay. And just go ahead and look straight ahead. Okay, so the light is midline in each pupil, so bilaterally the light is midline in each pupil with the corneal light reflex. Now we're going to go ahead and do its positions of gaze, so I'm just going to have you be looking at this in each position, okay? Let's take a look. Okay, great job. So you were able to follow the object smoothly in each position. Now we're going to go ahead and move on to a test called accommodation. So again, follow the pen light. I'm going to bring it inward. Keep your eyes on it, okay? Okay, ready? Your eyes crossed and your pupils constricted. So accommodation was present. Great job. Now we're going to go ahead and do the consensual response. So I'm going to go ahead and shine one light in this side, and I'm going to be looking at the other eye to see if there is constriction. Okay, and the pupil is constricted, so the consensual response was there. And when I shine the light, your pupil is constricted to about a 3, so from 5 to 3. That's awesome. Yeah, everything else looks great. So we're going to go ahead and move on to your nose. Are you, do you get frequent nosebleeds? No? Okay, so I'm just going to go ahead. Your nose is midline with the rest of your head, and your head is normal cephalic. Your nose is symmetrical, so can you just look back from me and then look inside? So there are fine hairs present. There's some mucus, but the nasal mucosa is pink. There's no lesions or anything like that, so that looks great. I'm going to do a patency test, so I'm going to have you plug one nostril and then breathe through the other. So let's start with your right nostril. Another one. You can breathe clearly through each one. Okay, so each nostril is patent. That's great. We're going to go ahead and move on to your mouth. Do you smoke any cigarettes?
No.
No? Okay, so open your mouth for me, please. Your teeth are white and clean. There's no signs of decay. Your buccal mucosa is pink and moist. Can you say ah? Your uvula raises when you say ah. Your tongue is smooth, pink, moist. Your soft and hard palate is smooth, pink. You're okay. And smooth, pink, moist. Your gums looks pink and moist. There's no signs of inflammation. Your tonsils, they were smooth, pink, moist. Once again, no signs of inflammation. You're able to say ah, and your uvula raised, so everything looked great. I'm going to go ahead and move your ears. Do you wear any hearing aids?
No.
Do you have any balance issues?
No.
Okay, so could you go ahead and tuck your hair behind your ears for me? Okay, so I'm going to go ahead and look at the auricle, which is the entire ear. Can you just look at me straight on? Okay, your ears are fully formed, they're symmetrical, they are appropriate skin color for your ethnicity, I don't see any lesions or bumps or masses. Can you turn to the side and look at your auditory meatus? Okay, your auditory meatus, there are fine hairs present, but there's no discharge, so awesome. I'm going to go ahead and feel your ears. Is that okay? So I'm going to go ahead and feel the auricle. Tell me if you feel any tenderness. Any tenderness?
No.
So non-tender. I'm going to feel your tragus. Any tenderness?
No.
Okay, non-tender, and both were firm. Now we're going to go ahead and we're going to perform a whisper test. So what you're going to do is you're going to plug your tragus like this, and I'm going to whisper a few things into your ear. Okay, so I'm going to come a little further.
1, 2, 3.
Yeah, and then do the other one.
ABC.
Yes, good job. So pass the whisper test. We're gonna go ahead and move on to your neck. Have you had any surgery on your neck, or do you have any issues moving your neck?
No.
No, you don't? Okay, so looking at your neck is symmetrical with the rest of your body. Your skin color is appropriate for your ethnicity. I don't see a goiter present. You have some lesions right here, and you have a small scar present, but other than that, everything else looks appropriate. I'm going to go ahead and feel your trachea to make sure it's midline. Okay, that hurt?
A little bit.
It hurt?
I fell snowboarding yesterday.
Oh, okay, so that hurt you right there. Okay, well, I won't touch it anymore, but just from palpating your trachea, I can confirm that your trachea is midline. Once again, no goiter, no lesions, no mass is present. So awesome job. I'm going to go ahead. Can you tilt your head kind of this way for me? And then the other way. Okay, jugular vein distension. I didn't see any pulsations present. I'm going to go ahead and, can you turn your head again? I'm going to feel your carotid. Actually, look at me. Sorry. Okay, your carotid is a 2+ bilaterally. We're going to go ahead and I'm going to feel your lymph nodes. So, you put your knee down a little bit closer. And then look at me. So I'm going to put my hands kind of around your head and area, and I'm going to do circular motions rubbing to see if I can feel any like bumps on your lymph nodes. Okay. So start here, preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical chain, and then I'm going to move down along the deep cervical chain. Okay, I didn't feel any bumps. Are you having any allergies or anything like that? Okay, so that makes sense because I didn't feel anything there. Your lymph nodes looked great. I'm going to go ahead, I'm going to go behind you, and I'm going to feel your thyroid gland. So you can just go ahead and sit there. I'm going to move behind. So if you could turn your head to the right a little bit, until back just a teeny tiny bit. I'm going to lightly touch right here. Okay, your thyroid, it feels smooth, but I can't really feel it. Can you turn this way? Again, smooth, but nothing notable. I don't feel any like swelling or roughness or any round ball type spots. So that looks great. We're going to do some range of motion of the neck now. Are you okay with that?
Mm-hmm.
Okay, if you feel pain, tell me.
Okay.
So if it's too much, let me know. We're going to do it with and without resistance. So just kind of copy whatever I do right now. So we're going to have you go look this way to the left, to the right, forward, back, and then shrug your shoulders. Okay, was that okay?
Mm-hmm.
Okay. And then we're going to do resistance. So push your head against my hand. Good. Good. Forward. Good. Back. Okay. And then shrug your shoulders. Okay, great. So range of motion was fluid. You didn't have any tenderness, right?
No.
Okay, so great. Range of motion was 5 out of 5 bilaterally. It was fluid. Everything looked amazing. So now we're going to go ahead and have you ever had any surgery on your thorax, chest region?
No.
This area? No? You've never had surgery on here?
I've had it on my back, but not like my chest.
Well, okay, yeah, like the back area too, just like
Okay,
your
then yeah.
entire act, like
Yes.
chest area.
Yes.
You have? Okay. So I'm going to need you to take your shirt off. And what we're going to do, I'm going to go grab a chair for you. I will be back very, very quickly. I'm going to have you sit just so your back is facing the camera. Okay, awesome. So already just taking, I'm going to inspect your back, your posterior side. I'm going to be looking at your lateral side as well as I'm doing the posterior inspection. So while I'm looking at this, I can tell you that your AP ratio is 1 to 2, meaning that your posterior back is twice the size as your lateral sides. So that looks great. You have some scarring down here. It looks like you have some growth marks. Is this from your surgery, this scar right here?
Yeah.
And it's not tender?
No.
Okay, you have no irritation, anything like that?
No.
Okay, so there's no irritation, non-tender. You have a few bumps, some freckles, and you have a tattoo on your left posterior shoulder. You have a tattoo on your right lateral side as well. Again, I don't see any lesions, bumps, masses, bruises. Your skin color is appropriate for your ethnicity, consistent with the rest of your body. You have some fine hairs present on the upper side of your back, but everything else looks great. So I'm going to go ahead and I'm going to start touching your back. Is that okay? I'm going to start moving along. Again, if you feel any tenderness or pain, let me know. Okay, I didn't feel any bumps, masses, lesions, anything like that, so everything looked great there. I'm going to go ahead and we're going to do just a little test. So we're going to do tactile femoris, we're going to do chest expansion, so sorry. I'm going to go ahead and move down to T 9 about right here. You can kind of lean forward just a little bit. Is that okay?
Mm-hmm.
Okay. Okay, and then if you could go ahead and just take a deep breath in. Okay, awesome. Your chest expansion was great. My fingers moved beautifully. Now we're gonna go ahead and I'm gonna do tactile feminist now. So I'm gonna place my hands on different regions in your back, and each time I place my hand somewhere, just say 99. Okay? So I'm gonna start here. Okay, awesome. Your feminist was symmetrical, so amazing. So now I'm gonna go ahead and I'm gonna auscultate. Or excuse me, I'm gonna go ahead and percuss. So I'm gonna feel up here and I'm gonna do some percussions. Excuse me. I'm gonna make sure I'm avoiding any bony prominences. Okay, lung sounds are resonant with each percussion, so that sounded great. Now I'm going to auscultate. So I'm going to be using the diaphragm, and I'm going to go ahead and start up here, just breathe like normal. Okay, lung sounds are resonant. So you can go ahead and flip it towards the camera. We're going to kind of do the same process on the interior side. So again, I'm just going to go ahead and inspect your anterior side. You have a little lesion right here, kind of towards your clavicle. You have some freckles present. You have fine hair present. And once again, just confirming the AP ratio, it is 1 to 2, meaning your chest is twice the size as your lateral side. And again, you have a tattoo that's on your right lateral side that kind of comes anteriorly. Your skin color is consistent with the rest of your body and is appropriate for your ethnicity. I don't see any bumps, masses, lesions, bruises, anything like that, but I'm going to go ahead and palpate just to confirm. And again, if you feel any tenderness, please let me know. Okay, I didn't feel any masses, bumps, lesions, anything like that, and it was non-tender, correct? No tenderness, so non-tender. I'm going to go ahead and do those same tests that I did before, so we're going to start with chest expansion. I'm going to kind of come like right here, and just again, take a deep breath. Yeah, great job. So chest expansion was present, it was beautiful. And now we're going to once again do tactile feminist. So every single time I place my hands on your body, go ahead and say 99.
99, 99, 99, 99.
Okay, great job. Tactile feminist was symmetrical. Now I'm going to move on to percussion. So I'm going to kind of Okay, with each percussion it was resonant, so everything sounded great. And now I'm going to oscillate. And again, just take normal breaths. Okay, the lung sounds were resonant. So has anyone ever told you that you have high blood pressure, or have you ever had heart surgery?
No.
Something like that? Okay. Do you have any chest pains ever?
No.
No? Okay. I'm actually going to go ahead and do your skin trigger. Okay, skin trigger looks great. Moving on, excuse me, sorry. So you don't have any chest pains, you don't have anything like that?
No.
Okay, so I'm going to go ahead and take a look at your anterior side. Looking at your chest region, so far I don't see any pulsations. Everything looks great. Especially looking at the apical pulse region, I don't see any pulsations there, which is exactly what we want. So I'm going to go ahead and I'm going to kind of feel underneath here if you don't mind. Okay, I can feel your apical pulse. It's about a 2+. I'm going to count for 30 seconds. So I counted for 30 seconds, multiplied by 2, so I got 64 beats per minute, which is great. I'm going to go ahead and kind of feel around this area again. I don't feel any masses, bumps, lesions, anything like that, any abnormal pulsations. So I'm going to go ahead and I'm going to listen to each valve of your heart, starting with the diaphragm. So I'm going to come to the second intercostal space where the aortic valve should be. And I can hear it. I hear S1, S2, or left dub. So I went to the second intercostal space, right sternal border. Now I'm going to go right across to the left sternal border, but also the second intercostal space. This will be your pulmonic valve. Okay, awesome, I can hear it. This one's really clear to hear, actually. This was S1, S2. I don't hear any murmurs. I didn't hear any murmurs with the aortic valve either, but yep, S1, S2, love dub. Okay, now I'm going to go ahead and I'm going to move to the fourth intercostal space, and this is where the tricuspid valve is. Okay, yep, S1, S2, no murmurs, and I'm going to go to the fifth intercostal space, mid-clavicular line, where your mitral valve will be. Yep, S1, S2, sounds great, and we're going to go ahead and do that again. We're going to do it with the bell. So, I'm going to go again, second intercostal space, aortic valve. Okay. Okay, S1, S2, heard, no murmurs or gallops. Go ahead, go to the second intercostal space on your left side. To the harmonico. S1, S2 is heard, no murmurs or gallops. We're going to go to the fourth intercostal space, where the tricuspid valve is. S1, S2 is heard, no murmurs, no gallops. We're going to go ahead and go to the fifth intercostal space, mid-clavicular end, where the mitral valve is. And I can hear S1, S2, no murmurs or gallops. So everything sounded great. Yeah, that was fantastic. So you can go ahead and stand up, and I'm going to have you lie down on the couch. No, it doesn't matter. And I'm going to go ahead and move the camera angle so you guys can see my abdominal assessment easier. It's not as clear as I was hoping it would be, but okay. So you can go ahead and put your hands to the side. Great. Okay. So do you have any issues urinating? You don't have any issues? Do you get constipated at all?
No.
Okay, awesome. So we're going to go ahead and I'm just going to take a look at your stomach region. So far, there are fine hairs present. Your skin color is consistent with the rest of your body and appropriate for your ethnicity. I don't see any pulsations, abnormal pulsations, especially looking in the umbilical area. Your umbilicus is inverted. You don't have any masses, lesions, bruises, anything of that sort present. Yeah, everything looks great. So I'm going to go ahead and I'm going to auscultate your right lower quadrant. And I hear a vowel sound. Oh, excuse me. Leave it down here. And I hear a vowel sound. Now I'm going to go to your right upper quadrant. And I hear a vowel sound. I'm going to go to your left upper quadrant. I'm over here. I'm right up here. And I hear a vowel sound. And I'm going to go to your left lower quadrant. And I hear a vowel sound. I'm going to go ahead and I'm going to, bless you, you okay?
Yep.
I'm going to go ahead and going to percuss. So I'm going to start down here. Oh, let me get a better one. And if you feel any pain or tenderness, let me know. Okay, and the sounds were tympanic, which was great. And I'm going to go ahead and do some light palpation. So I'm going to go just a little bit down. I was in your right lower quadrant. I'm going to go to your right upper quadrant, left upper quadrant, left lower quadrant. And did you have any tenderness?
No.
So non-tender, I didn't feel any masses or bumps, anything of that sort. So that looks great. Now we're going to go into deep palpation. So I'm going to go ahead and I'm going to press a little bit deeper, okay?
Mm-hmm.
So again, let me know if you feel any pain. Feel any pain? Okay. And I didn't feel any masses or bumps again. So non-tender, no masses or bumps present. So that was great. And I was able to hear normal vowel sounds in each quadrant. So great job. We're going to go ahead and you're going to have to sit up for me. I'm going to move this back. Okay, so how often do you get outside and go in the sunlight?
Probably about 4 to 6 hours a day.
Okay, awesome. So I'm going to go ahead and I'm going to take a look at your upper extremities. So, great. So looking at your upper extremities, I see that you have multiple tattoos present on your left arm. On your right arm, I don't see any tattoos present, but the left arm does have tattoos. You have a small scar, kind of towards your elbow region. You have some marks. You got some cuts on you. So he's got a few cuts and bruises and bumps, but is that, you said that you went snowboarding the other day?
Yeah, I skateboard and snowboard a lot.
Okay, so from skateboarding and snowboarding, that is a explanation for why he has as many cuts and bumps and bruises as he does. But he has fine hairs present. His skin color is appropriate for his ethnicity. I can see that his skin is more tanned compared to his thoracic region, but that just tells me that he is going outside and getting sun. Make sure you wear sunscreen. But everything else looks great. Can you just kind of do this with your hands? I'm going to go ahead and do capillary refill. So I'm going to touch them bilaterally, and I'm going to press the tips of your finger for about until it turns white, and then I'm going to let it return. Awesome. Yep, and within 3 seconds, the color returned back to its original thing. So I'm going to go ahead and fill your medial pulse again. 2 plus bilaterally, and I'm going to fill your brachial artery. Plus bilaterally. So that looked awesome. We're going to go ahead and do some sharp, light, and soft, or excuse me, sharp, dull, soft touch. So we're going to start with sharp and dull. So this will be sharp, and this will be dull. So close your, or you don't have to close your eyes, but this is sharp. You feel the difference?
Not much.
Do you want me to hear? I'll go harder. Sharp.
Not much of a difference.
Sure.
Yes.
No. Okay, so I'll press a little bit harder. So close your eyes and tell me when you feel sharp or dull. Okay? You don't need to tell me where you feel it, but just
sharp.
Actually, you do need to tell me where it is. I'm sorry.
Sharp left shoulder.
Thank you.
Dull right bicep. Dull left knuckle. Sharp left forearm. Sharp right forearm. Sharp right wrist. Dull left shoulder.
Okay, great. You did awesome. You were able to identify sharp and dull and in which anatomical location. So, great job. We're going to go ahead and move on to light touch. So, this is light. Just tell me when you feel it. You don't need to tell me where. So, close your eyes.
Feel it. 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 Feel it.
Okay, great job when you were able to identify light touch each time that I touched you. So, great job. We're going to go ahead and do some range of motion. So if you can kind of scoot that way a little bit. So we're going to start with some abductions. So go ahead and raise your arms like this. And then turn them upward, your palms up towards the sky. Come up all the way. We're going to do some, yep, and then behind. Awesome. And then we're going to have you come back. And then I'm going to have you do some range of motion with your arms, excuse me. So we're going to go ahead and do extension, flexion, and then we're going to have you do pronation and supination. Awesome. And then with your hands, we're going to do hyperextension, wrist flexion, and then we're going to have you do ulnar deviation, radial deviation, and then spread your fingers apart, bring them back together. Awesome. And then make fist. Sorry. Okay, great. And then we're going to do some, you're going to pull, or I'm going to pull your arms and you're going to try to fight me, okay?
Okay.
So have your arms. I'm going to pull them and then try to push against me. Okay. And then squeeze my fingers. Okay, great. So range of motion with each with shoulder, arms, and hands was 5 out of 5 bilaterally. And it was fluid in each movement. You didn't have any issues doing it, did you?
No.
It was fine? Okay, so yeah, range of motion was fluid, 5 out of 5 bilaterally. Great job. So what kind of work do you do?
I'm a welder.
Okay. Do you stretch or do you get sore frequently?
Not often, no.
As in you get, so let me rephrase. Do you get sore frequently?
No.
Do you stretch?
No.
Okay, so maybe some things that you could start doing, because welding is a physical job, maybe some things that you could start doing is just stretching, just some simple ones, because it will benefit your muscles and make you feel better, because I think once you really start getting into it, it's really going to start taking a toll and you're going to feel it. So maybe incorporating some more stretches will be helpful. But anyways, we're going to go ahead and move on to looking at your legs. Could you kind of hike your pants up as high as you are comfortable with? Can you do that one as well? Okay, thank you. So just taking a look at your lower extremities, you have some few scars. You have some scars around your legs. You have fine hairs present. Would you mind taking your socks off for me? I can take those over here for you. So, you can put that back on. Sorry. Okay. But looking at your lower extremities, you have a few scars present bilaterally actually on each leg. You have fine hairs present. Your skin color is consistent with the rest of your body. Your hair is, it's fine and thin, but you have a good amount of it. It was the same on your arms and your chest, fine, thin, but it was present and there was a good amount. You have some hair on your toes, which is good. It tells me that you have blood flow going to your feet. So that's really awesome. Everything looks great. I'm going to go ahead and do some capillary refill on your toes. Okay, and then the blood returned back to the toe within 3 seconds, so your capillary refill looks good. I'm going to go ahead and feel your pulse. I'm going to come right here. That's about a 1+. I'm going to feel your dorsalis pedis. There it is. Okay, 1+ bilaterally for each pulse that I did. Capillary refill looks good. I'm not feeling masses or lesions. There weren't any bruises present. We're going to go ahead and move on to dull and sharp and light touch test again. Just grab my tools. So we're going to start with dull and sharp. Okay, so I'm going to show you again what it feels like. That's sharp. Okay. So close your eyes and then tell me where you feel it and if it's sharp or dull.
Okay. Sharp left thigh, dull right knee, sharp right knee, sharp left knee, sharp left calf, sharp right shin, dull right toe, dull left ankle, dull right thigh, sharp left thigh.
Great. So you were able to correctly identify sharp and dull and which anatomical region I did it. So we're going to go ahead and move on to light touch. So this is light touch. Close your eyes. Just tell me when you feel it.
Okay. Feel it. 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 Feel it.
Great. So you were able to identify when you felt light touch correctly. So great job. We're going to go ahead and do some range of motion. So can you lay down?
Couch.
Yep, on the couch. Just like I know you're going to do your abdomen. So So I'm going to go ahead and I'm just going to take your legs and do this for you. Tell me again if you feel any tenderness or pain. And I will stop. You kind of scoot this way a little bit. Sorry, I got to move your legs this way. Did you feel any tenderness, pain?
Nope.
Okay, so range of motion was 5 out of 5. It was fluid movement. There was no crepitus present. So everything looked great. You can go ahead and sit up again. And this time I'm going to kind of need your feet off of the ground. So just kind of follow me when I do this. I'm going to move the camera angle so we can see it just a little bit better. So we're going to have you, if you can, point your toes down, all the way up, out, turn your soles in as best you can. Spread your toes, flex your toes. Great. Great job. Okay. Range of motion, did you have any pain?
Nope.
Okay, so range of motion was 5 out of 5. Fluid movements, no crepitus was present. Looked good. Okay. Have you ever had like a brain injury or a spinal cord injury?
I broke my back.
Okay,
a few years
has
ago.
that affected your walking?
I had to do a lot of physical therapy to learn to walk properly again. But
Okay.
I'm fine now.
Okay, so you don't notice any like foot drags or anything like that when you're walking? It's back to normal?
Yes.
Physical therapy worked?
Mm-hmm.
Okay, good. So what I'm going to have you do is I'm going to move the camera angle once again. And I'm going to have you walk all the way to that chair, just like normal. Okay, and then stop. And when you walk back, you walk toe to heel. Yes. Okay, awesome. You can sit. So your walk was great. When you were walking, your arms swung in opposite directions. You had a steady gait. I didn't see any swaying, any kind of imbalances. You were able to walk back heel to toe, which was great. It tells me that you have some balance and coordination. So that all looks really awesome. We're going to go ahead and do some tests. Okay, so I'm going to move the camera again. I'm going to have you just stand for a minute. Can't really see your face now, can you? Okay. And what you're going to do is you're going to put your feet together as best you can. And then you're going to close your eyes. Try to stay as still as you can for 15 seconds, okay? Okay, great job. So you had some swaying present, but overall Romberg test was negative. So great job. A little bit of swaying is normal. So yeah, you didn't fall over anything, so that looks great. We're going to do just a few more tests. You're going to touch your nose to my finger in different positions, okay?
Okay.
So go ahead. And then close your eyes. Good job. Yep, awesome. You were able to do the nose to finger test. Great. You were able to perform each movement smoothly. Even with your eyes closed, you were able to track my finger. So once again, that lets me know that you have some coordination and that your peripheral area, you're aware of it. We're gonna do one last test. We're gonna do some rapid alternating movements. So you're gonna have to push your hands like this, and then just move back and forth as fast as you can. Okay, yep, great. So you're able to swiftly move your hands smoothly in each position. So that all looks really awesome. I would document my findings, wash my hands, and leave the room.